This episode is brought to you by Nordstrom. Whether you're packing for a vacation or dressing for a wedding, Nordstrom has head-to-toe looks for wherever summer takes you. From swimwear and bold color to romantic florals and dresses that make an entrance, find the right style for every unforgettable moment. Shop new arrivals from brands you love like Farm Rio, Free People, Vince, Wait, and Stod. Plus free shipping and returns and styling help whenever you need it make it all so easy. Shop now in stores at Nordstrom.com or download the Nordstrom app.
If we knew more about our sleep, what would we do differently? Would we go to bed at a consistent time or take steps to reduce interruptions to our sleep? With Sleep Score, Apple Watch measures your bedtime consistency, interruptions, and sleep duration. Then, every morning it combines these factors into an easy-to-understand score from 1 to 100. So you'll know how to take the quality of your sleep from okay to very high. Know your sleep score with Apple Watch. iPhone 11 or later required.
Hey everyone, Chris here from MedPrep to Go, and welcome to another episode of our USMLE Step 2 Questions podcast. I'll be your host for today, and in this episode, I'll be reading 3 psychiatry questions from our online Qbank. And as always, you can read these questions and more at medprep2go.com. So let's get started with question 1, Psychiatry 10. An 11-year-old boy is brought to the psychiatrist by his mother for evaluation as mandated by his school. The patient was recently suspended from school and will not be allowed back until he is evaluated by a psychiatrist. The mother is interviewed alone, and the patient is asked to wait in the waiting room. His mother reports that there has been a series of incidents at school where other children have accused her son of bullying them. The patient has had behavioral troubles in school since kindergarten, where he would get up out of his seat and walk around class pinching the other children. She reports that her son is a very intelligent boy who refuses to apply himself in his studies. He has always had difficulty completing assignments on time, remembering to turn in assignments, and has resisted doing homework. She reports that the patient is prone to violent outbursts, where he screams at his mother and that he recently threatened her with a kitchen knife when she attempted to set boundaries. The last time the mother cleaned his room, she noticed that he had several pairs of sneakers that she did not purchase for him. Which of the following is the most likely diagnosis? Is it A, antisocial personality disorder? B, bipolar II disorder? C, conduct disorder? D, oppositional defiant disorder? Or E, intermittent explosive disorder? And the correct answer here is C, conduct disorder. Conduct disorder is a behavioral disorder with a persistent pattern of violating rules and basic human rights. There must be at least 3 of the following behaviors: bullies, threatens, or intimidates people, causes physical fights, has used a weapon to cause harm to a person, has been physically cruel to people or animals, steals or robs with and without confronting the victims, rapes, destroyed property, has destroyed property by burning, has broken into personal property, runs away, must be at least twice, violates curfew before age 13, and truancy from school. These behaviors must have been present for at least 12 months, with one of those behaviors occurring within the last 6 months. This constellation of behaviors must cause impairment in social functioning. In this vignette, the boy's behaviors have been present since kindergarten, and his last behavior is within the last 6 months. He shows a persistent pattern of aggression, dishonesty, theft, and violation of rules, which has led to his suspension from school. He is bullying at school and home, he is physically cruel, he has threatened his mother with a knife, and he is stealing. In pediatrics populations, social functioning is measured by school performance, ability to make friends, and getting along with family. Answer choice A, antisocial personality disorder, is incorrect. Antisocial personality disorder cannot be diagnosed before the age of 18. Answer choice B, bipolar II disorder, is incorrect. Bipolar II disorder is a mood disorder characterized by depressive and hypomanic episodes. In childhood, bipolar can present primarily as irritability. However, there is no indication that the boy's aggressive episodes are connected to episodes of a mood disorder. Answer choice D, oppositional defiant disorder, is incorrect. Oppositional defiant disorder is a pattern of behavior which includes argumentative or defiant behavior and vindictiveness with or without an angry or irritable mood. Oppositional defiant disorder often precedes conduct disorder and is significantly less severe than conduct disorder. Oppositional defiant disorder does not include aggression towards people or animals, destruction of property, theft, and deceit. Answer choice E, intermittent explosive disorder, is incorrect. In this vignette, the patient does have impulsive aggressive outbursts, however, they are instrumental and used to manipulate. Key learning point. Conduct disorder is a pattern of behavior which includes aggression, destruction of property, deceitfulness or theft, and/or serious violations of rules. Question 2, Psychiatry 11. A 10-year-old girl is brought to her pediatrician by her father for frequent headaches beginning 6 weeks ago. The patient has been late to school because of the headaches, and subsequently the father has been late to work. 2 months ago, the patient's mother moved out of the family home. The father reports that his daughter has been texting him from school multiple times a day to check in, and her teachers have noticed that she seems distracted during class activities. When interviewed in the presence of her father, the patient reports that she has been feeling worried because she is concerned that her father is going to get into a car accident on the way to work and die. Which of the following is the most appropriate treatment for this child? Is it A, antipsychotics, B, cognitive behavioral therapy, C, dialectical behavioral therapy, D, exposure therapy, or E, serotonin reuptake inhibitor? And the correct answer is B, cognitive behavioral therapy. The child in this vignette is displaying signs of separation anxiety. Separation anxiety is successfully treated with cognitive behavioral therapy, which is a type of therapy that challenges the beliefs which are the root cause of the psychiatric distress. Answer choice A, antipsychotics, is incorrect. Separation anxiety is not treated with antipsychotic medication. Answer choice C, dialectical behavioral therapy, is incorrect. Dialectical behavioral therapy, DBT, is a therapy created to treat borderline personality disorder. Answer choice D, exposure therapy, is incorrect. Exposure therapy is primarily used in the treatment of obsessive compulsive disorder or specific phobias. Answer choice E, serotonin reuptake inhibitor, is incorrect. A serotonin reuptake inhibitor can be useful for many anxiety disorders, but it is not first-line treatment for separation anxiety. Key learning point. Separation anxiety should be treated with cognitive behavioral therapy, otherwise known as CBT.
Bonjour, compadre. It's the
Priceline Negotiator.
How do I negotiate so many great travel deals? My greatest gadget, the Priceline app. It's got hotel deals, flight deals, rental car deals, all of those deals in a bundle. Deals, game day deals, concert trip deals. No one deals more deals than Priceline. Hold your horses, there's more. The app lets you filter hotels by neighborhood, vibe, star level, and amenities like pools and spas and beachfronts and... Wait, I'm not done. Stop cutting me off.
Priceline.
Girl, winter is so last season. And now spring's got you looking at pictures of tank tops with hungry eyes. Your algorithm is feeding you cutoffs. You're thirsty for the sun on your shoulders. That perfect hang on the patio sundress. Those sandals you can wear all day and all night. And you've had enough of shopping from your couch. Done hoping it looks anything like the picture when you tear open that envelope? It's time for a little in-person spring treat. It's time for a trip to Ross. Work your magic.
Question 3, Psychiatry 12. A 2-year-old girl is brought to the emergency department by ambulance for acute somnolescence and disorientation. The patient was being cared for by her elderly aunt when she was found lying in the hallway. Vital signs are 37 degrees Celsius or 98 degrees Fahrenheit, heart rate of 90 beats per minute, and blood pressure 72/37, respirations of 12 per minute, and shallow. On physical examination, the patient is obtunded with minimal responses to painful stimuli. Pupils are equal, round, reactive to light, and constricted bilaterally. Skin is warm and dry with no signs of bruising, rash, or other lesions. Which of the following is the most appropriate treatment? Is it A, cyproheptadine, B, dantrolene, C, flumazenil, D, fomepizole, or E, naloxone? And the correct answer is E, naloxone. Naloxone is an opioid antagonist used in the emergency treatment of opioid overdose or intoxication. In this case, the patient is showing signs of opioid intoxication. Rates of accidental opioid intoxication are increasing. Key findings in this case include somnolescence, constricted pupils, and decreased respirations. Answer choice A, cyproheptadine, is incorrect. Cyproheptadine is a first-generation antihistamine that can be used for the treatment of serotonin syndrome. Serotonin syndrome may result from intoxication with serotonergic medications and can present with agitation, disorientation, clonus, diaphoresis, tachycardia, hypothermia, and hypertension. Answer choice B, dantrolene, is incorrect. Dantrolene is a postsynaptic muscle relaxant used for the treatment of neuroleptic malignant syndrome, NMS. NMS can present with altered mental status, cardiac arrhythmias, tachycardia, tachypnea, muscle rigidity, diaphoresis, and high or low blood pressure. NMS can result from intoxication from antipsychotic medications. Answer choice C, flumazenil, is incorrect. Flumazenil is a GABA receptor antagonist used for reversal of benzodiazepine intoxication. Benzodiazepine intoxication would present with altered mental status, somnolescence, and ataxia. Answer choice D, fomepizole, is incorrect. Fomepizole is an alcohol dehydrogenase inhibitor indicated for treatment of ethylene glycol ingestion. While the initial signs of ethylene glycol appear similar to this case, ataxia, slurred speech, drowsiness, irritation, restlessness, and disorientation, ethylene glycol intoxication does not present with constricted pupils. With ethylene glycol intoxication, the patient would present with tachypnea in later presentations as a compensation for metabolic acidosis. Key learning point: naloxone is a medication used to treat opioid overdose. And that will conclude this episode of our USMLE Step 2 Questions podcast. I hope you enjoyed it and found the information useful. Please be sure to follow us at MedPrep2Go on LinkedIn, Facebook, Instagram, and YouTube to stay up to date with our content. You can learn more and read other Step 2 questions at medprep2go.com. Happy studying! Hey everyone, Chris here from MedPrep2Go, and I wanted to tell you about our MedPrep2Go Step 3 review podcast that features over 90 episodes and 40 hours of high-yield content from Dr. Ted O'Connell and Dr. Raj Dasgupta. This is a premium podcast that has already helped over 100 students pass their exam. You can learn more and subscribe at medprep2go.com. Hey everyone, Chris here from MedPrep2Go, and I wanted to let you know about our premium Step 2 Bundle podcast, which gets you all of the Step 2 secrets and our Step 2 Questions podcast combined and ad-free. You'll also get early access to all of our Step 2 Questions episodes before they're released public. The bundled podcast is available now, and you can save over 40% with an annual plan. Details at medprep2go.com.